Welcome guys, thanks for tuning in into the Toothfairy. Today's topic of choice will be dental cavities. Today we will talk about how cavities are formed, how to prevent them, and what to do if you do get one, and what will happen if you don't. Stay tuned. Before I can talk about dental cavities, I want to talk about tooth structure. Your teeth are actually composed of different layers. The first one enamel, the second one dentin, and then you have the pulp chamber where your nerves are. I am bringing this up because we're actually going to be mentioning these tooth structures as we go on throughout this video. When you first get a cavity, it actually begins at the first layer, at the enamel, and eventually can get bigger and hit the second and the third layer. You can get dental cavities by not brushing properly, not flossing daily, and having poor nutrition. And we will talk about all of this as we go on. So it's really hard for me to say that cavities are completely avoidable. They're not completely avoidable because I think that your genetics could play a role on it. However, there's certain things that you could do to minimize having cavities. One of the things that you can do is brush twice a day. I know that it sounds simple, but you will be surprised how many people don't brush twice a day. Brush twice a day for 2 minutes with a fluoridated toothpaste. The sodium fluoride on the toothpaste actually helps remineralize areas that have become soft because that's how cavities begin. Another thing that you can do is floss every day. Not sometimes, not when you remember, but every day. Because brushing alone does not clean in between the teeth. Good nutrition is really important to avoid getting dental cavities. The reason why nutrition contributes to dental cavities is because depending on the foods that you eat, it actually contributes to lowering the pH level in your mouth. pH level is pretty much something that could be either very acidic or base or neutral. But whenever you drink something like soda or lemonade, it actually drops the pH level in your mouth to something that is more acid. If that happens, then you are more prone to getting dental cavities. However, there are ways that you can go around that. If you want to drink soda, you can have water afterwards. If you're gonna drink soda or a lemonade, drink it with a meal instead of you sipping it throughout the day, because like that you allow the mouth pH to actually go back to neutral. However, if you are constantly drinking lemonade, sugary drinks, monsters, things like that, then you're never allowing your mouth pH to actually go back to neutral, which means that you are going to be more prone to having dental cavities. Another thing is food. If you're going to have a lot of sticky, chewy food, it's bad for you just because it takes longer for your saliva to actually break it down, which will also help to contribute to dental cavities. So nutrition is good for you overall. You are what you eat, however. So make better choices and you get less cavities. If you do get a cavity, it's okay. It is not the end of the world. There's definitely options there for you. The first thing would be when you go to the dental office, they would take sometimes radiographs or they'll do an intraoral exam and they will determine what would be your best treatment. Sometimes if the cavity is very small, it's called an incipient cavity. It's just a fancy term to say baby cavity. If it is a baby cavity, sometimes they just put a fluoride treatment just to help remineralize the area and watch it. However, if that first layer, remember how we talk about the layers, the enamel, the dentin, and the cavity starts on the first layer and then it goes to the dentin layer, then however, at that point, a fluoride treatment will not be helpful because it's at the second layer of the tooth. At that point, you might need a filling. A lot of offices use mostly composite filling, which is pretty much the white filling. They're not using the amalgam fillings. However, some dental offices are still using the silver filling, which is the amalgam filling. But the most important thing is that you can definitely just get a filling done. The very first time that they diagnose it and they tell you you need a filling, just do it. Do not wait for it to get bigger because if you wait and it gets bigger, you're just going to have a bunch of other problems. And we'll talk about that here. So if you do have cavities and you need to fix them, but you don't, and as time goes by, the cavity just gets bigger. It actually doesn't stay small. And remember how earlier, again, we talked about the layers. So you get a cavity, it starts off on the first layer, the enamel, and then the dentin, the second layer. However, the serious part comes when it hits the third layer, where the pulp is, where the roots are, and all your nerves, because you could get an infection, not just a cavity. If that happens, you can have a lot of pain, among other problems. So it is really important to fix them, because if that cavity actually reaches your nerve, at that point they will have to do a root canal and a crown, and that's more money, more work. Whereas if you would have fixed it at the very beginning, then it would have been less work and less money. The other thing is, if you do have cavities, having cavities, that means that you have the bacteria for it. If you have cavities, this is really important. Please do not share your straws, your cups, your spoons with children, because this bacteria can actually be transferable. And if you transfer it, you can potentially give them the bacteria to actually be able for them to have future cavities. So let's prevent it. So again, if you have cavities, it's not the end of the world. It can be fixed. If you want to prevent them, keep brushing, keep flossing, and have good nutrition. And if you have any questions, please post them. I'm actually really good about answering back, and I would be more than happy to help if you have any questions. Thank you for your time. Thanks for watching the Toothfairy. I also want to introduce you guys my dog. Her name is Lexie. You're going to be seeing her in my videos here and there. So here's Lexie. Lexie, come here. Come here, Lexie. There she is. If you found that this video was helpful, I encourage you to like it, write a comment, share it, but most importantly, subscribe, like that you can get notifications of my latest videos that I post. Thank you so much for watching the Toothfairy. Until next time.